Good morning to you all. My name is Nimmi Joseph. I am an RN. Today I am going to talk about asthma. I will explain to you what is asthma, the signs and symptoms, prevention, causes, treatment, treatment effectiveness, and how the lifestyle modifications can help to reduce asthma attacks. What is asthma? Asthma is a condition in which your airways narrow and swell and produce extra mucus. This can make breathing difficult and trigger coughing, wheezing, and shortness of breath. In this slide, you can see the picture of the lungs and airways. You can see the upper right, the cross section of the airway is narrowed due to swelling or extra mucus. You can also see the cross section of the normal airway. There are no visible obstruction, so the air is able to go in and out easily. We are going to talk about the causes of asthma. Exposure to various substances that trigger allergies and irritants can trigger signs and symptoms of asthma. Asthma triggers are different from person to person and can include airborne allergies such as pollen, animal dander, mold, cockroaches, and dust mites. Respiratory infections such as common cold. Physical activity, that is exercise, can cause induced asthma. Some people will be cold air will be a cause of asthma. Air pollutants and irritants such as smoke first-hand and second-hand smoke. Certain medications such as aspirin and ibuprofen. Strong emotions and stress, that means your excessive crying and excessive laughing, both can cause asthma. Sulfites and preservatives added to some types of food and beverages including shrimp, dried food, processed potatoes, beer and wine also cause asthma for some people. Gastroesophageal reflux disease is a condition in which stomach acids back up into your throat. Some people, this will be a cause for asthma. And women, during their menstrual cycle, some women get asthma attacks. And these are the picture of the asthma triggers, that is pets, exercise, pollen, insects in the home, chemical fumes, cold air, smoke, pollution, stress. This all triggers asthma. Now we are going to talk about prevention. First, we have to identify and minimize contact with your asthma triggers. Understand and take asthma medications as prescribed. Recognize early signs and symptoms and that your asthma is getting worse. That means you are coughing or wheezing, you are experiencing shortness of breath, then you have to take your inhaler immediately. Know what to do when your asthma is getting worse and get vaccinated for influenza and pneumonia. Staying current with vaccinations can prevent flu and pneumonia from triggering asthma flare-ups. Take your medications as prescribed. Pay attention to increasing quick relief inhalers. We are going to talk about treatment. Asthma can be controlled but not cured. Avoiding triggers or reducing exposure to triggers, using medications to control symptoms. Medications, generally two types are used. Taken to prevent excess production of mucus and to reduce the inflammation and constriction of airway muscles. Rescue or quick relief drugs. Taken to relax muscles around the airways to improve breathing. The right medications for you depend on a number of things, including your age, your symptoms, your asthma triggers, and what seems to work best to keep your asthma under control. Preventative long-term control medications reduce the inflammation in your airways that leads to symptoms. Sometimes the doctor can prescribe you some allergic medications if your asthma is due to allergy. Poorly controlled asthma leads to increased visits to doctor, emergency room, hospitalizations, and it will limit your daily activities. You may lose some of the school days and lower quality of life. Some people can even die due to asthma. How we can monitor the treatment effectiveness? Monitoring the quality of life, that is your functional status. How many days you missed the school? Are you able to, you have the complete attendance for the year? How well are you able to do your daily activities? And whether you are able to sleep completely all night? This all will make, if your treatment is working well, you will be able to function fully. And monitoring drug therapy. Patient compliance, inhaler technique, frequency of use. How frequently you are using your inhaler. And frequency of oral steroid therapy, how frequently you are taking your medications. Dose changes of inhaled anti-inflammatory medicines. That means if you are keeping well, you know you have to take only the requested amount of medications. But if your asthma triggers are, your treatment is not effective, that means you have to increase your dosage and the frequency of the medications. And you have to go to your doctor's frequency of periodic assessment by clinician and patient. Mild, intermittent to mild persistent asthma under control for 3 months, and you may go to the doctor after 6 months for reassess. And if it is under control, you no need to go and visit the doctor in between. And the patient self-assessment, you can also make sure the treatment is working well. Keep a daily diary and write down the symptoms. The peak flow is an instrument used to measure the lung capacity, how often you are using the inhaler, how often you visit the doctors to visit, and how you are able to do your daily activities and how satisfied are you. And the lifestyle changes also can make modifications to increase asthma triggers or asthma attacks. Using an air conditioner. Air conditioning reduces the amount of airborne pollen from trees, grasses, and weeds that finds its way indoors. Air conditioning also lowers indoor humidity and can reduce your exposure to dust mites. If you don't have air conditioning, try to keep your windows closed during pollen season. Decontaminate your decor. Minimize dust that may worsen nighttime symptoms by replacing certain items in your bedroom. For example, encase pillows, mattresses, and box springs in dust-proof covers. Remove carpeting and install hardwood in your room or use washable curtains and blinds. Maintain optimal humidity. If you live in a very wet and damp climate, talk to your doctor about using a dehumidifier. Prevent mold spores. Clean damp areas in the bath, kitchen, and around the house to keep mold spores from developing. Get rid of moldy leaves or damp firewood in the yard. The next one is reducing pet dander. If you are allergic to dander, avoid pets with fur or feathers. Having pets regularly bathed or groomed also may reduce the amount of dander in your surroundings. Clean regularly. Clean your home at least once a week. If you are likely to stir up dust, wear a mask or have someone else do the cleaning. Cover your nose and mouth if it's cold out. If your asthma is worsened by cold or dry air, wearing a mask can help. The key thing is staying healthy. Taking care of yourself and treating other conditions linked to asthma will help keep your symptoms under control. For example, get regular exercise, maintain a healthy weight, eat fruits and vegetables, control heartburn and gastroesophageal reflux diseases, and talk to your parents if you are having any trouble or any problems. As I said, asthma cannot be we cannot cure asthma, but it can be controlled if you are taking care of well. While learning this, the causes, the treatment, and you know that now how you can manage your asthma. And I thank you for your time, and if you have any questions, please ask the questions now.